Hello, 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 hello. Hi everyone. Hi everyone. Yeah. Hi everyone. Yeah, yeah. Good evening. Good evening, everyone. Good evening, everyone. Yeah. Okay. Good evening. Good evening. Okay. So all set for today's lecture. We have completed a very big, and you can say huge unit, that is breast. So as of now, let us see what are the things that are already done. So let us see this. Why is not working? You people make wonderful memes, na? Huh? You people make wonderful memes. Awesome, huh? Can't keep myself matlab, laughing many times. So good. Okay, so you can say topics covered. Topics covered. So if you have done burn, there is no need to study burn. If I'll cover it again. First is breast. First is breast. Then second, in breast we have done developmental anomalies, benign breast disease. Yeah, I'll answer all those questions. Actually, I was not feeling well yesterday. That is why I couldn't answer your queries. But definitely today, by tomorrow, all your queries will be answered. CA breast. Then vascular surgery, if you talk about, already the complete lecture is uploaded. Vascular surgery, lymphatics, lymphatics, arterial, and venous. Now, what are the topics that we will cover from 7th to 10th of May? 7th and 8th, I will be doing burns, and 9 and 10, we will be doing flaps and grafts. And there only we will deal with the reconstruction part. So these are all the topics that we have to complete or we have completed. Okay. So today, let us start with a new unit, that is plastic surgery. Yes, plastic surgery. So the next unit that we are going to study is plastic surgery. Plastic surgery, if you talk about plastic surgery, I don't know. I don't know about nine. Huh? I don't know about nine. Okay. So comprises of two important chapters: burn and graft and flaps. Burn and graft and flaps. But the vascular surgery has already been completed. The videos have already been recorded and uploaded on eMedico's app. Yes, whenever you get time, you revise them. Okay, whenever you get time, you revise them, make your concepts. Okay, let us talk about burns. If you talk about burns, the first thing that you should know is about the classification of burns. Classification of burn. When we talk about the classification of burn, whenever we talk about classification of burn, the first thing that we should know is percentage based classification. Percentage classification. Percentage classification. Now let us see. Arey bhai, I don't know about 9. If it's a holiday, then it will be a holiday. Yes or no? If it's not a holiday, then it will not be a holiday. Chalo, let's move forward now. So what about the classification of burns? There are various classification of the burns. One popular amongst them is percentage classification. Do you know, according to percentage classification, burn is further classified into mild, moderate, and severe. So burn is classified as mild, moderate, and severe. Yeah. Last day I'll show you that all those images. Don't worry. So mild, moderate, severe. Mild, moderate, severe. When we talk about mild, moderate, severe, how do we define them according to the percentage of burn? So it could be PTB. I hope you know PTB, and if you don't know PTB, let me tell you, PTB stands for partial thickness burn. Partial thickness burn. So partial thickness burn, how do we classify mild, moderate, and severe? Mild, moderate, and severe. Partial thickness burn, for child, the criteria is different, and for adults, the criteria is different. For children, the criteria is different, and for adult, the criteria is different. Try to understand. Mild, less than 10% partial thickness burn is considered to be mild. 10 to 20% of partial thickness burn is considered to be what? Moderate. More than 20% of partial thickness burn is considered as severe. So for kids, it is less than 10, 10 to 20, more than 20, more than 20. Let us move forward. Next is, if we talk about adults, less than 15% partial thickness burn is mild. 15 to 25% partial thickness burn is moderate, and more than 25% is considered to be severe. So the percentage burn criteria is different for child versus adult. Next is, let us see this thing. What about FTB? What about FTB? FTB stands for full thickness burn. Full thickness burn. FTB stands for full thickness burn. Burn I've taught. I've taken class on satellite. I don't remember also I've taken class on satellite or no. But yes, if I have taught you chapter burn, most of the things are going to be same. Now let us think. What is full thickness burn? Less than 2% is considered to be mild. 2 to 10% is considered to be what? Moderate. More than 10% is what is considered as severe. So this is what is mild, moderate, severe. Mild, moderate, severe. Okay. So less than 10, 10 to 20, more than 20. Less than 15, 15 to 25, more than 25. These were respective criteria for classification on the base of percentage for partial thickness burn in case of child and adult respectively. If you talk about full thickness burn, it's less than 2, 2 to 10, and more than 10. Now, do you know what is important about them is others. Others. Mild category of burn includes sunburn. Sunburn is included in mild. Sunburn is a mild. Sunburn is a mild. What about moderate? What about moderate? Yeah. If you talk about moderate, burns other than face or perineum. So burns other than face or perineum is what is classified as what? Moderate. What is classified as moderate. And then we have severe. If you talk about severe category burns, they include all those special burns. All those special burns. Can you tell me some special burns? Like electric burn, chemical burn, what else? Radiation burn, what else? Burn involving face and perineum, burn involving face and perineum, burn involving face and perineum. Yeah, students, only in case of partial thickness burn, Yes, the percentage criteria is different for adults versus kids. Otherwise, everywhere the things are same. Next comes management. Next thing is their management. If you talk about management, mild burns are managed in OPD care only. Okay, so try to understand that mild burns can be comfortably managed in OPD. We'll discuss the management later on. I'm just writing it here. But what is important is try to understand that and severe moderate and severe burn, they require hospital admission. So hospital admission is required by moderate or severe burn. You know, the chapter will be over and one student will ask me, sir, you have not taught me the criteria for referral to a burn center. What is the referral criteria to a burn center? Now try to understand one very important thing. Try to understand. But say in case of children, if there is partial thickness burn more than 10%, in case of adults, if there is partial thickness burn more than 15, or any full thickness burn more than 2%, or any special burn or burn involving face and perineum, all of them have to be referred to a burn care unit. Because you see, in hospital, where do you admit them? Where do you admit them? You admit them in what? General ward? No, you admit them in the special isolation ward, which is meant for care of burn patients. So try to understand all the things which are included in moderate or severe. They qualify as a criteria for admission to, or you can say for referral to, a burn specialized center. Next is, there is one more case where you require admission in hospital despite the fact that percentage rule is not satisfying this. Let us see this. Do you know burns involving, yes, burns involving hands, or you can say, so involving burn involving hand, palm, or sole. Burn involving hand, palm, or sole, they also require hospital admission. Now let me tell you one very interesting thing, that do you know? But I'll tell you what is partial thickness burn. Don't worry, I'll tell you. So let us see this thing. This is palm. So palm with extended fingers, this palmar surface contributes roughly around 1%. Two sides of palm along with wrist, that will make what? Hand. Hand contributes around 2.5%. Same is the case with what? Sole also. So by percentage, they're quite less. But then also, we refer them to a special burn care unit. Why? Now, this is a question, that even though this qualifies for 1% only, then why are you referring them? Because burn is an inflammatory process, and the problem with burn is that there is exudation. Do you know, if there is exudation, there will be collection inside the hand, or you can say the extremity. And whenever there is collection inside, there will be increase in what? Yes, very good. There will be increase in compartmental pressure. There will be increase in compartmental pressure, and this compartmental pressure will ultimately cause what? Necrosis and gangrene. So there is a fear of development of compartment syndrome. So this is going to cause you necrosis as well as what? Gangrene. Necrosis and gangrene. That is why. Now there are three important things to remember in this. What are the three important things to remember in this? So we, in a topic, we are going to revise, or you can say just discuss 2 or 3 points about compartment syndrome. 2 or 3 points. I hope most of you know that compartment syndrome is due to increase in intracompartmental pressure. Now the question is, at what pressure you get the symptoms, and at what pressure the gangrene, or you can say necrosis, starts. So answer is, compartment syndrome, yes, starts at starts at pressure more than 30 mm Hg. 30 mm Hg. And do you know necrosis or gangrene, necrosis or gangrene is seen at what? Yes, at pressure. Necrosis or gangrene is seen at pressure more than 45 mm Hg, more than 45 mm Hg. So try to understand this. This is very interesting thing. Each and everything has been asked in your exam. That features of compartment syndrome starts at, option was 30 mmHg also, 45 mmHg also, 50 also, and 20 also. The answer was more than 30 mmHg. The feature starts. The feature start. Necrosis happens at what pressure more than, or gangrene happens at more than 45 mmHg. Now try to understand. This was a question in AIMS 2019. What is the most reliable clinical sign? What is the most reliable clinical sign? Clinical sign. Now try to understand. If you're doing extension, flexion, extension, yeah, if you're doing extension, this is not painful. This is not painful. But if there is what? If there is compartment syndrome, and if you ask the patient to do passive extension, it will be extremely painful. So when you demonstrate this passive extension and there is pain, why there is pain? Because of the intense pressure causing compression over the nerves and the other structures. So most reliable clinical sign, very good, it is pain on passive extension, or you can say movements. Simply, if you move the joint, it will be painful. So pain on passive movements, or you can say extension. Pain on passive movements, or you can say extension. This is what is the most reliable clinical sign. And here only, in a nutshell, I'll discuss the management of compartment syndrome also. Management of compartment syndrome. What is the management? Answer is fasciotomy. Fasciotomy. What is fasciotomy? Suppose this is hand, you will start cutting it until and unless you release the intracompartmental pressure. This is what is the management of what? Yes, this is what is the management of compartment syndrome. Students, now let us go to the second part of the classification. That is the degree-based classification. There are many students who are asking, sir, what is partial thickness burn? What is full thickness burn? You'll get all the queries answered here only. Okay? Now, what someone is asking, what is the significance of what? What is the significance of pressures? Students, compartment syndrome never means gangrene. Compartment syndrome means the pressure causing increase, you can say there is increased resistance now. And thus, there is a time window where in which if you act, you can salvage that limb or salvage that compartment. Otherwise, the pressure will be so high that yes, there will be absolute ischemia causing necrosis and gangrene. So amputation will be done of an extremity if you ignore that thing. And these hands, do you know they're not having that much of elastic space? So yes, even a small amount of collection inside can raise the pressure drastically. Now let us move forward. Next is degree-based classification. So next thing that we do is a degree classification. Degree classification. If we talk about degree classification, we have first degree, we have second degree, we have third degree, we have fourth degree. You must have studied some further classification in FSM, etc., fifth degree and sixth degree. That is not that significant. So let us see. First degree burn. What is a first degree? I hope everyone has written this compartment syndrome, but what is a first degree burn? This is a burn involving epidermis only. Yeah. So what is a first degree burn? This is a burn involving, it's a burn involving epidermis only. It's a burn involving epidermis only. Yeah. But your pressure is increasing because this compartment is non-elastic. If I put 50 cc of saline inside this compartment, is this compartment prepared to accommodate that 50 cc? No, it will not be able to accommodate. And ultimately the pressure will start to rise. So burn involving epidermis is known as first degree. Do you know what is the absolute, you can say, indication to visit the consultant, or what is the most important problem of the patient? Answer is these burns are painful. You can say very painful. Do you know why? Epidermis is like a cling film. You must have seen when you go to a bakery, you get what? You get a sandwich packed in a what? Cling film. So if you want to eat, you have to remove that cling film. So epidermis is similarly like a cling film. The moment it is exposed, the moment it is removed, actually, the dermal nerve fibers or nerve endings are freely exposed off. And do you know dermal nerve endings at their tip are extremely sensitive. So if someone touches or the part comes in contact with anything, the stimulation is so quick and it's very painful. So try to understand they are painful. Yes, if you talk about CRT, what is CRT? Capillary refill time. This is capillary refill time. Capillary refill time. Capillary refill time is absolutely normal. Capillary refill time is absolutely normal. You know what is the problem here? When you want to assess the sensory nerve endings by doing a pinprick stimulation test, again the pinprick sensation is intact. So there is no loss actually. So pinprick sensation is intact. Do you know? They will never show you blisters. If you talk about blisters, blisters are never seen. Now the concept is why blisters are never seen. When there is so much of exudate, blisters should form. The problem happens, yes, it always tried to form. Now this is dermis and this is epidermis. When there is burn in the epidermis, always there is an initial attempt by the inflammatory fluid to form a blister. But do you know this is too thin to sustain itself, and that is why they always, what, over the time, the moment this blister forms, that very next moment there is increase in pressure and there is disruption of this damaged epidermis. So do you know blisters try to form, but actually they cannot sustain. So you should say that blisters actually don't form in case of what? First degree burn. Whenever they try to form, the moment there is distension of epidermis, it disrupts, and that is why we don't see blisters. However, they blanch. You have a blanching on test. So blanching is plus plus plus. They show you blanching. Yes, let us move forward. Apart from this, if you see them, there will be extreme redness, and that is what is known as erythema. Erythema is again plus 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 plus. Now concept is, what is the management? What is the management? Now students, let me tell you, the only problem which this patient is facing is pain, 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 pain. Now what is the next thing that you do? There is a burn here, you put a dressing. And when you put a dressing, do you know what happens? The inflammatory exudate is what is absorbed by the cotton or the fibers of the dressing, and ultimately this dressing will adhere firmly. Now this dressing is adhered firmly, and after 1 week when you try to take it off, along with this, the newly formed epidermis will also be peeled off, and again there is a second injury. So again reach a place from where you started with. So try to understand, you need a barrier. Why do you need dressing? So that you can disconnect this wound from the external environment, or you can prevent this from getting in touch with anything. So you need something as a barrier, but again the second thing is that it should not be what? Occlusive one. You must have seen there is a net. You must have seen, yes, very good. There is a net which is impregnated With what? Yes, with a special wax, and that wax you must have studied is known as what? Paraffin. So there is a net which is having this paraffin loaded gauze, and yes, this is what is ideal. Why? It will provide that you can say desired barrier effect also without sticking. So do you know paraffin dressing is sufficient? Yes, student. Bactigras, very good. So paraffin dressing is sufficient. Bactigras, you have Gelonet. Yes, Bactigras, Gelonet. Yeah, all these things are. Next is second degree burn. Second degree burn. Let us see what is the difference between first degree and second degree. Now, first degree was confined to epidermis only. Second degree, it involves epidermis. It involves epidermis plus dermis. And in bracket, you should write variable thickness. Variable thickness. So it involves epidermis and dermis. Okay. Vigil, you are right. Some people are using Colgate paste. Yes. This is reality. Yes, this is reality. Maybe because of menthol giving that cooling effect. This is the only reason that menthol or the mint that is present in the toothpaste that gives a bit cooling effect, and it soothes the burning sensation there. That is what is. Otherwise, Colgate is not having that. I don't think Colgate is having that. Otherwise, we would have used it. It's a cheaper alternative. But yes, it's useful only for what? First degree burns. In first degree burns, it may be because their actual damage has not happened. It is the epidermis which has been denuded, and things will be normal within a week. You can write one point also. Yes, one point in first degree burns, that it heals within 1 week, or you can say 7 days. So first degree burns, you can add one point also. Important is they heal within 1 week or 7 days. They heal within. Yes, coconut oil also you can use. Coconut oil also use. What's it? Dove I have not tried. Huh? Coconut oil, so honey no, I have not tried. Dekho, you can use one thing. You can use cow's urine also. Cow's urine plus cow's dung also. Cow's urine plus cow's dung also. You can make a paste 50-50 lotion. You can apply it. You can eat it. You can drink it. Yeah, because you. So you can do this also. You can do this also. Okay. Okay. Let us move forward. Involves epidermis and dermis. No. I am very sorry. I will not utter anything. Do you know? If I utter anything, there are people who just take it, who might be sentimental, and who will say, how dare you say, and then how dare you say that cow's urine. My yoga teacher, I have appointed one yoga teacher, and during when the corona broke out, he used to come to my home. I said, why are you not wearing mask? He said, हम corona नहीं मानते. Why? I said, why you don't? Bole sir, we are yoga person. That is why we don't believe in corona. We don't believe in corona. I said, then how will you manage corona patients? He said, so do you know, you will not believe, you are a surgeon, you will laugh. So we were we were on a terrace garden, we were doing yoga, and he told me that, do you know, we have actually the treatment of corona. I said, bhai, if you have treatment of corona, tell me, I'll also try. Because yes, Ayurvedic, yes, there are very good things. So he told me that you wake up early in the morning, go to cow. Yes, go to cow, holy cow. And then at 4 a.m., he told me at 4 a.m., you take out the urine. And that urine, you have to, yes, drink it. Not only this, he told me that cow dung, in reality, he told me cow dung plus little bit of camphor plus little bit of coconut oil put in both the nostrils and ear, there cannot be any infection entering into your what? Do you know? I live on I live on 10th floor. I live on 10th floor. I thought I should jump down. But again, I care sentiments. We don't hurt any community. So I care about their sentiments. I said, okay. I am not going to try, but definitely you can tell this plan to ICMR. They might use it. And yes, if they would have actually used it, you would have not got 50,000 cases. I think we missed something. Chalo, let us come back. So second degree burns involve epidermis and dermis and variable thickness of dermis. Do you know, if you talk about pain, yes, pain is there. They are painful. Second is, what about capillary refill time? What about capillary refill time? Capillary refill time. What about capillary refill time? Tell me, capillary refill time is increased. Capillary refill time is increased. Do you know what about pinprick sensation? Pinprick sensation. Pinprick sensation is intact. Pinprick sensation is intact. Are you laughing? Ramdev has challenged. He can cure. You can say carcinoma pancreas. You must have studied something about CA pancreas, na? We are morons. We do surgery, that is Whipple's, for 5 or 6 hours, and then we tell patient that 5-year life expectancy will be only what? You can say 15 to 20%. Ramdev has challenged that he has cured at least 20 patients. He has cured at least 20 patients. Do you know? God forbid, if MD Anderson oncosurgery people get to know this, they will commit mass suicide. They will all stand and all of them will hang, because this is the end of the planet. CA head pancreas can be cured with what? Cow's urine. There are ministers who say that cow's dung, yes, can prevent you from nuclear radiation, nuclear hazards. Let us leave it. So when we talk about second degree burn, pain is present, capillary refill time is increased, pinprick sensation is same, intact. But do you know what? Here you get to see blisters. Blisters are seen here. Do you know they have a wet appearance, wet and blotchy appearance here? Wet and blotchy appearance. Wet and blotchy appearance. Wet and blotchy appearance. This is what you can say. These wounds are not dry typically, they are wet and blotchy. Wet and blotchy appearance. Now let us talk about the second degree burns. If you talk about second degree burn is of two types. Second degree burn is of two types. What are the two types of second degree burn? We have partial second degree burn. We have partial second degree burn, and we have full thickness second degree burn. So we have partial second degree burn and we have full thickness second degree burn. Now, all of you should pay one attention. What about this partial versus full thickness? Now just see. Do you know the name full thickness? This is a misnomer. This is a misnomer. So full thickness burn, this is not a full thickness burn. Do you know? This is a misnomer. Why this is a misnomer? Because it involves variable thickness of dermis. It involves various thickness of dermis. I'll explain it to you. Second degree partial, second degree full. Now let us see what is second degree partial, second degree full. Now try to understand. Suppose this is epidermis. Let us take this to be epidermis. Okay. And now we have dermis here. This is dermis. Do you know dermis has two parts? Yeah. The upper one is known as papillary dermis. Upper one is known as papillary dermis, and the lower one is known as reticular dermis. Reticular dermis. So you have papillary dermis also. You have reticular dermis. Now try to understand one very interesting thing. All of you will look and then draw. Everyone will look at screen now. But a partial thickness second degree is something which involves epidermis also and what? Dermis also. Epidermis also and papillary part of dermis. Now full thickness second degree is something which involves epidermis, papillary dermis, and in some patches it might extend into the dermis, reticular part of the dermis also. By definition, it involves both the layers of the dermis. That is why we call them full thickness. So students who are asking what is the criteria for full thickness burn, it should involve entire length of epidermis and dermis. If it is not, it is what considered as a what? Partial thickness burn. So if you see, by definition, it is extending into the dermis. So we, you can say reticular dermis. So we might write it to be full thickness, but in true sense, this is not a full thickness second degree. This is not a true full thickness second degree. Try to understand, this is very important point, because many of you are confused in this thing. Now let us see healing time. Now healing time, please draw this and then I'll move forward. This is a full thickness second degree and this is a partial thickness second degree. Just draw this and then we will discuss. Let us move forward. But a partial thickness or full thickness, all full thickness will require admission if it is more than 2%. Admission criteria I've told you, boss. Partial thickness burns if they are less than 10% for kids, less than 15% for adults, you'll not admit. I think Rahul, you got your question? Yeah. Let us move forward now. Let us move forward. Healing time is 2 to 4 weeks. 2 to 4 weeks for partial second degree. Partial second degree. I've already told you. But why capillary refill time? Because of the damage to the capillaries. Capillary, what do you mean by capillary refill time? But you press it and when you release, the blood flow is what? You see how quickly the blood flows in. Because of the damage, there is vasoconstriction, and that is why the things happen. Okay, let us move forward. Healing time, boss, is 2 to 4 weeks, and here it is 4 to 6 weeks. Now again, do you know there is a concept of pigmentation? There is a concept of pigmentation and scar. There is a concept of pigmentation and scarring. Do you know one very important thing, that P for pigmentation? Remember, P for pigmentation and P for papillary dermis. If papillary dermis of the skin is involved, pigmentation ought to happen. If reticular is also involved, do you know reticular dermis is the most metabolically, you can say, most active part. If reticular dermis is also involved, then there will be scarring also. So try to understand what you will get in this. You will get pigmentation will be seen in partial thickness, but not in partial, you can say, scarring will not be seen. But here, pigmentation also and scarring also to some extent will be seen. So yes, blister starts from, answer is second degree. Scarring starts from, again, second degree. To be more specific, full thickness second degree. Yes. Now the third one is third degree burn. Third degree burn. Let us talk about what is third degree burn. Let us talk about what is third degree burn. If you see, third degree burn is defined as complete full thickness damage to the dermis. Yeah. So complete destruction of epidermis plus dermis. Management will see later on. Don't worry, students. Management we will see now, because that patient, those patients, the first degree burns, they're OPD based patients basically. So we don't, you can say, specifically mention the management for them. But now onwards, The management will be what? We'll discuss the management at the end. Like you have to give fluids, you have to start with some protocols for nutrition, for sepsis. So we'll discuss this at the end. Don't worry. So complete destruction of epidermis and dermis. Now let us see. This is very, very, very important. You get to see black, painless, black, painless. Why painless? Because entire length of dermis has been completely charred. So nerve endings are destroyed. So black, painless, leathery, black, painless, leathery skin known as eschar. Eschar. But say due to damage to skin adnexa. Yes, you have skin adnexal structure. That is why pigmentation happens. Na? You have melanin in the skin. They are damaged. That is why. So this is what is known as eschar. Black, painless, leathery skin known as eschar is seen. Do you know the vessels are associated with thrombosis? So associated with superficial venous thrombosis. Superficial venous thrombosis. So there is no concept of CRT now. The skin has been completely destroyed. That is why it's painless. Next is, if you talk about healing, but they will not heal until and unless you excise and put a graft. So do you know they require excision followed by skin grafting. So try to understand the moral of story is that they will not heal spontaneously. They require excision and then skin grafting. Now we come to the last degree of burn, that is 4th degree. What do you mean by 4th degree? Answer is 3rd degree plus damage to deeper structures. Damage to deeper structures. What do you mean by damage to deeper structures, students? Yes, damage to deeper structure means, yes, burn involving muscles, you can say bones, yes, cartilage, etc. Muscle, bones, cartilage, etc. So it's something which is extending from skin onto the deeper structures. That is what is 4th degree. Now I'll ask you one very interesting thing, that what do you mean by full thickness burn? I've told you full thickness burn. What is full thickness burn? Suppose if you are confused, still you are confused, how to remember, use your surgical sense. Can you see the answer? Can you see the answer in this? You have to see the answer. What is that? 4th degree and 3rd degree. So students, 4th degree and 3rd degree are considered to be a true full thickness burn. Remember, 2nd degree full thickness is not a full thickness burn. 2nd degree full thickness is not a full thickness burn. Let me tell you what is the difference between someone is asking 2nd degree full thickness and full thickness actual, that is 3rd degree and 4th degree. But a 2nd degree full thickness is something like this. It is not completely involving. This is 2nd degree full thickness. And what is a full thickness true burn? It involves something like this. It involves everything at that point. Wherever this happens, entire dermis is involved. Can you see here there is patchy invasion or patchy burn? So patchy burn cannot be taken as full thickness burn. You have to have complete damage of the dermis. This is why this is very important. Now try to understand this thing. Let us move forward. Next thing that we do in burns is zones of burn. Zones of burn. Do you know what is this concept of zones of burns? Let me discuss this with you. These are also known as Jackson's zones. These are also known as Jackson's zones. Today and tomorrow and day after tomorrow, the topics now which are left, they're very small, and they're very interesting. Yes, you may have to write a lot, but they're not that very tough to understand. It's very easy. Now, do you know the place where burn actually happens is maximally damaged? Just around that area, again there is some zone of injury, and again around that area there is again zone of injury. I'll draw this for you. Suppose it's something like this. This is one zone, yes, and then this is the another one, this is the another one, and then you have the another one. Yeah, it's something like this. Try to understand. There are three zones. There are three zones of burn. This is zone 1, this is zone 2, and this is zone 3. This is zone 3. Something like this. Zone 1, zone 2, and then we have zone 3. 1, 2, and 3. 1, 2, and 3. Zone 1, zone 2, zone 3. Now, what is significance of these zones? What is significance of these zones? Now, try to understand. Zone 1 is a zone which has been completely damaged by the process of burn, where the burn actually started with. So, do you know zone 1 is known as zone of zone 1 is known as zone of coagulation. Zone 1 is known as zone of coagulation. Zone of coagulation. Now, what do you mean by, yes, students, of course, 4th degree is next step of 3rd degree. So it has to be what? Painless, na? Zone of coagulation, this is completely destroyed zone. Completely destroyed zone. You can say complete necrosis or complete coagulative necrosis happens. Coagulative necrosis seen. So maximum damage happens to this zone. So maximum damage happens to zone 1. Let us talk about zone 2. If you see zone 2, tell me what is zone 2 known as? Zone 2 is also known as zone of what? Zone 2 is also known as, very good, zone of stasis. Zone of stasis. Yes, Somil, this is non-viable. Now, why it is known as zone of stasis? Because this zone is associated with actually vasoconstriction. Now, do you get to know why CRT is increased? Because of vasoconstriction. Yes, vasoconstriction, the CRT is increased. Now, the next is, third zone that we have is zone of hyperemia. Zone of hyperemia. Zone of hyperemia. What is significance of this zone of hyperemia? Hyperemia. This is the zone which is farthest from the site of burn. And not only this, this is the zone where you get to see vasodilatation. You get to see vasodilatation. Now try to understand. I'll ask you one very simple question. Which zone amongst them is the most vulnerable zone? Which zone amongst them is the most vulnerable zone? Most vulnerable zone. Which zone is most vulnerable? Zone 1, zone 2, or zone 3? Students, try to understand. Already zone 1 has been completely destroyed. Very good, students, very good. Now, if you don't act at this moment, if you don't stop the process of burn, next Zone to be destroyed is zone of stasis. So vulnerable means today it is present, but tomorrow you cannot guarantee if you don't curtail the process of injury. So that means most vulnerable, most vulnerable zone is zone 2. Most vulnerable zone is zone 2. But say zone 1 has already been destroyed. It's completely necrose zone. It's already a dead zone. So you cannot say zone 1 to be most vulnerable. This is what is the point here. Next is, let us talk about the third thing in this is, let us discuss about prognostic factors. Prognostic factors. Let us talk about prognostic factors. Prognostic factors. There's a score which is known by a name which is known as revised box score. Revised box score. Now let me tell you one very important point about this revised box score. If you see what are the parameters of box score and what are the parameters of revised box score, but you should use your common sense to take out the answer from this question. Can you see the answer here? Can you see the answer here? And can you see the answer here? Yes. What can you see? बच्चे, B for burn surface area. BSA stands for burn surface area. Burn surface area. Next is age. Age. And third is inhalational injury. Inhalational injury if present. Okay. Now try to understand 2-3 important things about this. But amongst them, age is the most important. Age is the most important prognostic factor. Age is the most important prognostic factor. 8 is the most important prognostic factor. No, students, I'll tell you. So I'll clear your doubt also. But this was the question, and I have been discussing this question at least. Now I can say I have discussed this question at least 200-300 times. Yeah, I'll tell all these things. 200-300 in all batches across the, you can say, country. Now my point is, there's a question which has been put up by an app. Let me tell you about that thing also. Just wait. Okay, let me tell you about this. So there is one app, or there are variety of apps. So one of them have asked a question, and this is a very famous, most important prognostic factor. The first option was depth. The second option was burn surface area. Third option was age. And fourth option is inhalational injury. Fourth option is inhalational injury. Inhalational injury. Okay. Now, this question, Dams Club was flooded with this question, and everywhere the students were having that very same query. I'll not name or defame anyone. So most of them were asking, and the answer given there is inhalational injury. Inhalational injury. And they said, sir, you have taught me this, and they have given me inhalational injury as the answer. Tell me this thing. Okay. Image is not there. Okay, I'll describe it now. What happens? Now try to understand. Do you know age is considered as the single most important prognostic factor in some places? I'll come to that inhalational injury part later on, but I'll describe how the prognostic factors are working. Now try to understand. Have you heard of burn surface area? Yeah. Burn surface area is deceptive in many cases. Like if you talk about radiation burn, if you talk about chemical burn, If you talk about, you can say electric burn. In electric burn, the point of entry is very small, and so is the point of exit. The injury which happens actually is injury to blood or soft tissues, which you cannot estimate by calculating or by seeing the burn surface area. So burn surface area is also not absolute. People don't know the definition of burn. Burn means any injury to the body due to fluctuation of environment around it. So burn is any injury to body due to fluctuation of environment around it. Now I'll ask you one very simple and straightforward question. 8-year-old with 20% burn, 8-year-old with full thickness 20% burn, compared to 28-year-old with 20% full thickness burn, compared to 80-year-old with 20% full thickness burn. Amongst them, who will have the best prognosis? Tell me. 8-year versus 28-year versus 80-year. Tell me who will have the best prognosis. Answer is what? 28 years. Why? Because with the age, you gain that endurance or strength to withstand the environmental fluctuations around yourself. Try to understand this thing. That is why age is considered to be the most important prognostic factor in case of burn. But you don't mug up surgery. Surgery is full of concepts only. There is nothing like, you can say, memory. You have to just understand, and once you understand, you'll never have confusion. Now comes the question, inhalational injury, which is anyone who has framed this MCQ is ignorant. He's not knowing or she's not knowing what is burn. Burn always never mean, or you can say burn never always means inhalational burn. Do you know, if you have inhaled toxic gases, then only the concept of asphyxia or inhalational injury comes into play. And that is why the box score was changed to revised box score. They have integrated that concept of inhalational injury. Now I'll ask you, can you define how, or you can tell me how can you define inhalational injury in case of frostbite? Yes, even you stuff your nostrils with what? Ice, then also you'll not have what? Inhalational injury. How can you define inhalational injury in case of chemical burns? Yeah, yes, you have to push the chemical inside your what? Nostrils or oropharynx, then only you will have. How can you define inhalational injury in case of electric burn, where the cause of death is arrhythmia because of ventricular fibrillation? Again, the age comes. Age comes to withstand what? The arrhythmia, or it changes in the myocardial, you can say, activity. How can you define inhalational injury in variety of burns? There are variety of burns. But say, if you talk about hot burns also, scald, or you can say, suppose if your hands, both the hands are charred, but still you're not having inhalational injury. Suppose you sat on a hot plate and your bums are completely charred 100%. Will you have inhalational injury? No. But don't mug up. Don't make a prototype. I will have a parasurgical sense. Always try to understand, yes, you're a noble human. Yes, noble, you can say, noble citizen. You have to abide by the law, and the law says you have to follow the discipline of surgery in your life. And in surgery, there is nothing like 1 + 1 is 11. Yes or no? So we are morons. We have very thick concept. Anything which we can explain, we take it, else we reject it. We don't believe this happens, so happens. Like there is fish-like odor of urine of this disease, so you believe. But in surgery, you cannot say. You have to prove why this happens, then only I'll believe. So, bache, yes, inhalational injury is important concept, important prognostic factor, but yes, there is only one thing. If it is present, then only it will come into role play, because inhalational injury can cause asphyxia and immediate death. That is why. So you can say inhalational injury is a very important prognostic factor in case of inhalational burns. Now, students, let us go to the concept of types of burn. Types of burn. Types of burn. Just wait, but I'll just close this app. types of burn. If you talk about types of burn, burn can be hot. So the first burn that we do is hot burn. Now, if you talk about hot burn, what are the various types of hot burn? Let us see this thing. What are the various types of hot burn? Let us see this thing. Hot burns can be further subdivided into scald. It can be further subdivided into scald. Do you know scald? This is burn associated with hot fluids. Burn associated with hot fluids. Hot fluids. Yes, this is what is scald. But now imagine you're enjoying a cup of coffee and unfortunately that coffee spills over you. So that is what is going to create a scald type of hot burn. Then the next is flame. Flame burn. This is burn associated with superheated steam. Burn associated with superheated steam or oxidized gas. Oxidized gas. Burn associated with superheated steam or oxidized gas. I'll tell you this concept. This is very interesting. Now imagine you went for picnic, yeah? You went for picnic. Your friends are enjoying, yeah, you are talking, yeah. Oh, those days were very nice. Yeah, those days were very nice. Yeah, very nice. And one of your friend was saying, yeah, I'm not getting that quick kick. I'm not getting that swag. Huh? I'm not getting that swag. So what he did, he went closer. And now he again said, no, I am not getting that swag. And do you know, still he has not reached fire. He's 7 to 8 feet away from that actual site. But see, he can feel the extreme increase in temperature. Do you know why? Because the air near the flame, or you can say air near the fire, is superheated and oxidized. The moment he says, no, I'm not getting that sense, I'm going close, he will directly take off. Yes, you know, yes, gone. So try to understand what happens actually, but see, it is the steam or oxidized gas which is going to cause you a damage. That is what is flame. So scald, flame. Then third is, student, flash. Flash. What is concept of flash burn? This is associated with inflammable substances. Inflammable substances like petrol, all those like spirits, all those inflammable substances will just burst out in flames in a fraction of a second. That is what is known as flash. So flash versus flame, you have to understand. Flash burn is different, flame burn is different. Next is D. It's friction burn. Friction burn. What is the concept of friction burn? This is burn associated with contact with hot surface. Burn associated with contact with hot surface. This is what is friction burn. Now next, these are all types of hot burn. The second burn that we deal is what is cold burn. Cold burn. Cold burn. If you talk about cold burns are of two types. What are the two types of cold burns? What are the two types of cold burns? One is freezing injury. One is freezing injury and one is non-freezing injury. One is freezing injury and one is non-freezing injury. Yes, you are right. You're right. I'll tell you. Okay. Now, what is difference between non-freezing and freezing? Yes. let me tell you. Bache, what is burn? Burn is any damage inflicted on body because fluctuation of environment around that. Yes or no? So try to understand, this is any damage associated with exposure to extreme cold temperatures. Extreme cold temperatures. So non-freezing injury is any damage due to exposure to extreme cold temperature, but try to understand, but not sub-zero. Try to understand, this is not below 0 degrees centigrade, because below 0 degrees centigrade, whatever injury is inflicted, this is classified as freezing injury. So any damage associated with exposure to sub-zero temperature, exposure to sub-zero temperature. Now again I'll revise this thing with you. But see, what are the examples of non-freezing injury? You must have heard of trench foot. Yeah. Or you must have heard of frostbite. You must have heard of that cold water immersion syndrome. Cold water immersion syndrome. Cold water immersion syndrome. But see, what is the concept of cold water immersion syndrome? I'll tell you. You must have heard stories, na? What happened to great grandmother? We used to ask her, na? We used to ask our parents or grandparents what happened to great grandfather, what happened to great grandmother. So they will tell that, do you know, the great grandfather, they will tell you that one fine day, great grandfather, color is not coming. Yeah, great grandfather decided to go to Gangotri. You know Gangotri? Yeah, it's a, you can say, pilgrim place for Hindus. Yeah, there's a big glacier, and that is the glacier of Ganges. So people often go there, and they want to take that dip in that holy Ganges, and they want to wash off their sins. Yes or no? So Dadaji was so motivated when he went to Gangotri that he did not pay any heed to anyone, and then Dada just jumped inside. You know, the moment Dada jumped inside, what happened? Gone. Where? Yes, where? Star. You know, after death we become star. Yeah. We should not write death. I never write death. I say star. Once death happens, parents tell, na, where is Dadaji there? Where is Nani there? Where is Ye there? So we know, na, death, star. So why this happened? Because the body couldn't change or acclimatize to the sudden fluctuation of temperature. Let me tell you, this is a very sincere request. You should tell to everyone that whenever we take shower in winters, you must have heard of, no, parents. There are grandparents who say, "Do you know, I am 88 years old, but still I wake up at 3 a.m. in winters, and I don't use geyser. I take bath, I take shower in that cold water only because I want to be strong." Okay, it's right. But do you know what happens? Whenever you take a shower, you should first expose your hand, or you can say your foot. Why? There is no fat here, and the nerve endings are freely exposed. The moment you put your hand under the water, the temperature is sensed by the body and your body is acclimatized. But when you do this, when you take the shower on your head first and it's very cold, there is a sudden vasovagal collapse. You have sinus bradycardia, and then tararam pum pum, gone. And that is why whenever you take shower, don't take the shower on your head. You must have heard of the ice bucket challenge. Huh? People did not tell about this vasovagal collapse. Otherwise, no one would have taken. Thousands have lost their life just because of this. What you can say, chutiya. So you should not use this concept of what? Taking the shower on what? The head. Let us move forward now. Let us talk about this frost, or you can say freezing injuries. Do you know freezing injuries is of two types? Freezing injury is of two types. If you talk about freezing injury consists of two types. I'm sorry, I am taking, this is a public apology. Before you write a big letter to the DAMS people about the obscene vulgar language used by DAMS faculty, I'm very sorry. I just I was lost in flow. Yeah, surgical flow. That is what is known as surgical flow. Actually, surgical flow starts like this. I'm very sorry for what I said. I'll not do it again. Okay, but actually, this is what is surgical flow. This happens in OT now. So these things start. Anyway, let us come back. So one thing is frostbite. One thing is frostbite. No, what is frostbite? What is no? There are some people now who will take the snapshot, and this is the level to which DAMS faculties have fallen. Actually, these are not DAMS students. These are Uncle G's with fake profile. And is this we are going to give to our kids? We are going to teach them. Is this the level of doctors coming up in the society? Blah blah blah. They should be penalized and this and that. But che, I said only something. If you go to hospital and you hear the conversation between the resident and the professor, then what you will say? Is this the generation which have evolved over the time, or is this the past from which we have evolved? Let's see. So please, don't take it personally. This was all the things were mere coincidental. I'm not targeting anyone. Okay, let us see. So what do you mean by frostbite? What do you mean by frostbite? Frostbite means intracellular freezing. Frostbite means intracellular freezing. Intracellular freezing. Now, do you know what happens whenever there is intracellular freezing? Yes, what happens? Now, there is, you can say, decrease in what? Vascularity. And when there is decrease in vascularity, there is going to be ischemia, and this ischemia is going to cause all that damage. Ischemia is going to cause all the damage. Do you know, by definition, frostbite is irreversible. Frostbite is irreversible by definition and logic. But still, you must have heard people saying that I have treated frostbite and these patients recovered successfully. Let me tell you very interesting thing. I'll tell you the story. Most of you must have heard, but this is so interesting, and every time we have a different lot of students, so I always feel overwhelmed telling them. I'll tell you. This was it was 16th. It was 26th of December 2016, and that time I was in Beijing, and I had a flight to return to country on 27. So I had 1 day weekend. So I decided to go to Great Wall of China. You know, Beijing is in northern China, and northern China is extremely cold during winters. And the temperature, it was, my phone was showing minus 13 somewhere, and wind blowing at 5 kmph, so it feels like minus 17, 18. Before that, I was in Jiamusi. There the temperature was somewhere around minus 28, 29 degrees centigrade also. But I was not roaming here and there freely. So that day I decided to go to Great Wall of China. I went to battling stretch of Great Wall of China. But the problem is that Indians are not, me being an Indian, I'm not acclimatized to that temperature. If you talk about Indians, but see, we are acclimatized to what? We are acclimatized to 45, or you can say 55, or you can say 65 degrees centigrade. We can even tolerate 85 also, maybe even 90 degree also, maybe 100 degree also. 100 degree also we can tolerate. You people are laughing. But say on a warm sunny day, if you park your vehicle outside for 2 hours, do you know the temperature inside is twice the atmospheric temperature, and over dashboard windscreens it is even 2.5 times. So average temperature in summers in India is somewhere around 46, 47. So you can always expect a temperature of 100 degree. You must have seen when you park your vehicle outside and when you touch the steering, it's just like you have a burn. First degree burn can happen. And this is the biggest problem, that when we have the vehicle outside and we move outside the building and this is our car which is parked, what we do, we just rush towards our vehicle, yeah, and we run, we sit down, we switch on the AC at, you can say, the maximum speed, and then do you know what happens? Yes, they're gone. Why gone? Because of stroke. Why stroke happens? Again, sudden massive fluctuation. Sudden massive fluctuation. Do you know that at 100 degrees centigrade, all the chemicals in the upholstery, or you can say dashboard, that all those vinyl chemicals, they give out toxic fumes, and that is why it is advised to switch on the, you can say, vehicle, switch on the AC and open the windows or open the gate for maybe 1 or 2 or couple of minutes to allow the toxic fumes to escape. Is that clear? So don't create a death trap, and this is very, very, very important. And that is why it is advised now that we should lower the window by 2 or 3 fingers. But the problem in India is that if you lower the window by 2 or 3 fingers, someone will insert the hand and you will not get back your vehicle. So there are many problems in India. We have to adjust. India is the country of jugaad and adjustments. Just wait. India, we have to adjust. Yes, we have to adjust to the things. Next is, so I was telling you about the paddling concept. I went to paddling and Great Wall of China. I thought of clicking 2-3 photographs. So I took off my gloves and clicked 2-3 selfies. Yeah, and just put the gloves back on. Within 5 minutes, there was excruciating pain. There was excruciating pain in both of my hands. And do you know, I knew that this is sub-zero temperature, that is below 0 degrees Celsius. And this is, I think I met with frostbite. I still remember that was the worst pain of my life. And you know, I was thinking all these things, frost. I was thinking that, oh my God, frostbite means intracellular freezing. Intracellular freezing means loss of vascularity. Loss of vascularity means ischemia. Ischemia means gangrene. And gangrene means ye haath mujhe de de Thakur. That is amputation. Ye haath mujhe de de Thakur. And I was thinking, I've just started my career. I have just started my career. And how will I look without my hands? How will I look without my hands? And then there were 2 options coming to my mind. What were the 2 options? The option number 1, I saw next to the wall, there was a big George. I thought of jumping inside. I thought of jumping from that, because without hands, what will I do? Nothing. But the very next moment I decided I'm a surgeon. And you know, a surgeon is one who accepts the defeat at the end, or at the time when really he has been defeated. So I decided, no, I will do something. I have heard of people making drawings or art from their foot. I'll go back to country, I'll learn those drawings, and I'll do something to manage livelihood, but I'll not commit suicide. I rushed outside that Great Wall of China exit, and at the exit there were some bakeries. Yeah, bakeries, local bakeries, you must have seen, and they had a big clay oven. I started warming my digits there. And within, you can say, 5 or 6 minutes, or you can say 10 minutes, basically, I could feel the sensation back. Now, I was thinking that I know that frostbite is irreversible. How is this possible that I have the sensation back? I thought maybe my mother is very religious. I started thanking all those idiotic babas whom I curse a lot. So I started thanking Baba, and I just took out my phone. I went to that chapter, freezing injuries, burn, opened that column of freezing engine. This time I was reading it with a lot of curiosity as of what has happened to me actually. And there I came across a condition that even when the extremities or the body has been exposed to sub-zero temperature, there is a phase which is known as prodromal phase, where you have all the clinical features which may be suggestive of frostbite, but yet intracellular freezing is yet, intracellular freezing is yet to happen, and that phase is known as frost nip. So students, here is a special term for you. What is frost nip? Bache, frost nip is defined as prodromal stage. Prodromal stage of frostbite. Do you know what is the significance of this? Intracellular freezing is yet to happen. So you should know that clinical features clinical features are present, but intracellular freezing is absent. And actually, next time when you hear someone saying that I have treated a patient of frostbite, no, you have not treated a patient of frostbite. You have actually successfully treated a patient of frost nip or maybe impending frostbite, because by definition, frostbite is considered to be what? Irreversible. Irreversible. Let us move forward now. Let us move forward. Let us talk about the management of frostbite. All the special burns, thermal in, or you can say freezing in cold injuries. Okay. All the special burns, I'll discuss the management here, and the common management of thermal burns, I'll discuss at the end. So management of cold burns or cold injuries. Management of cold injuries. Answer is the first line is equal to treatment of choice. First line is equal to treatment of choice is equal to conservative. First line is equal to treatment of choice is equal to conservative. Next is what is conservative management, students? What is conservative management, students? Yes, the conservative management is rapid re-warming to 42 degrees centigrade. Rapid re-warming to 42 degrees centigrade for 15 to 20 minutes. Students, in this span of 15 to 20 minutes, bache, this was the question in, yes, NEET PG 2019-20 session. What is the temperature to which we do rapid re-warming? Yes, this is 42 degrees centigrade for 15 to 20 minutes. If you see the signs of reversal, you continue with that. If you don't see the sign of reversal, yes, then you should know that this is a time to plan amputation now. So plan is now amputation. Plan is now amputation. This doesn't mean, suppose this is a patient, yeah, and patient's relative has brought, yeah, this is patient and these are patient's relative, yeah, these are patient's relative. Okay, now the patient was brought to hospital at, you can say 9 a.m. yeah, the patient, or 3 a.m. patient has been brought at 3 a.m. 3 p.m. 3 a.m. and at 3:15 or maybe 3:10 or maybe you can say 3:15, you saw that there is no sign of what? Reversal. This doesn't mean that at 3:20 or 3:30 you'll take out the extremity and gift it to what? Relatives. Lo bhai lo, le jao, mubarak ho, amputation has been done. No, amputation cannot be done until and unless you have a dry gangrene. That means line of demarcation has evolved. That might take 2 hours, 20 hours, 2 weeks, 20 weeks also. But you will counsel the patient that since this extremity is not showing any sign of reversal, we doubt the salvage. I think we have to go for amputation, but we will do it once we have the what? Once we see the line of demarcation appearing. So this is what is very, 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 very important. Next is, let us go to the third category of burn that we do is chemical burn. Chemical burn. Yes, chemical burn. If you talk about chemical burn, try to understand these are corrosives. It could be alkali, it could be acid. Now you will tell me which one is more dangerous. I know the answer. You know the answer. Alkali or acid? Alkali or acid? Which one is dangerous? Acid or alkali? Yes, acid or alkali. Let us see. Let us see this thing. But see, the concept is very simple. When you talk about acid, when acid falls on the body, the protein, if you talk about the protein, what happens to protein? The protein is coagulated. When the acid falls on the body, the protein is coagulated, and ultimately there is formation of something which is known as what? Coagulum. Do you know this is coagulum? And what is so much important about this coagulum? Coagulum is equal to impermeable. This is impermeable. And if something is impermeable, what will happen, students? Yes, therefore, acid burns are self-limiting in nature. Self-limiting in nature. So alkalis are not of this nature. Do you know why alkalis are not of this nature? Because alkali, they show lysis of protein. They don't coagulate the protein, they dissolve the protein. So they cause lysis of protein, and therefore, no coagulum, no coagulum, and therefore they are not self-limiting. Is that clear or no? So this is why it's dangerous. The second point why it is so dangerous, I'll tell you now. This is one. It causes lysis of protein. The second concept is, do you know, when we take a shower, we need some soap also. So what is the main essence of that soap? Answer is alkalis. The soaps are made up of alkalis. Why? Because alkalis can what? Saponify the fat. Yeah. So all that grease or dirt is removed from your body. So do you know alkali will cause saponification of fat? And if there is saponification, of fat, what will happen, students? Yes, there will be lysis of fat and hypothermia will happen. Hypothermia will happen. So hypothermia happens because of saponification of fat. Next thing is, let us see one very interesting thing. Third is, do you know when you buy instruments or machineries, alkali, there are sachets of alkalis. Why the sachet of alkali is put? Because alkalis are hygroscopic, so they keep that environment dry. Yeah. So being hygroscopic, it's hygroscopic, and since it is hygroscopic, do you know it will absorb all the body's moisture, and ultimately what will happen, boss? Dehydration. So can you see, not only it is causing dehydration, also hypothermia, and the main concept is it is allowing the alkali or corrosive to penetrate deeper. So these are the three reasons, the reason why alkalis are more dangerous than what? Acids. Once you've completed this, then I'll go forward. Why I'm telling you these things? Because most of you know about the concept of lysis of protein. And this question comes in PGI Chandigarh. But PGI Chandigarh, do you know, is fond of topic burns. This session, last session of PGI Chandigarh, there were 4 questions from the topic burns. So you have to have command. You know, PGI Chandigarh is the easiest of all exam if you actually know how to study and how to prepare. It's an exam where your basics are to be what? Revised again and again, because they'll put 5 points or 4 options out of 5 will be right. And if you know only one, if you have that, if you have that concept of mugging up MCQ, you'll not be able to crack anything. You might mark one response as right, but other responses you'll be lot more confused. So PGI is only for students who have a very good concept. Let us move forward now. Let it be any type of chemical burn. The management I will discuss here. Since this is a special burn, so I'll discuss it here. So management of chemical burns. Whenever you have a patient of chemical burn, you will not ask the patient or patient's relative to show you what chemical it was. Rather, you will not waste time and start rapid washing of wound, or you can say rapid washing of burn site under running tap water. Have you written? Has everyone written? I'll repeat, don't worry, huh? Under running tap water. I'll complete this and then I'll revise that part, huh? Under running tap water. And do you know this is running tap water, not ice cold temperature? Why? Because there are few people whenever there is what you can say chemical burn, they open the fridge, they search for the most, you can say, the most chilled bottle of that refrigerator, and then they start pouring it on your wound. What will happen, students? Yes, what will happen in this case? The hypothermia will worsen. The hypothermia will worsen. So what is not to be given? Ice cold water is not to be given. It should be water at room temperature. Water at room temperature. So ice cold water, yes, it's never used, or cold water is also never used. We use water at room temperature. Room temperature. Yes. Let us move forward now. Has everyone written this part? So I move forward. Huh? Okay. Okay. Next, this is done for 30 to 45 minutes. This is done for minimum 30 to 45 minutes. देखो, if the patient tells you about the chemical and you come to know that it is alkali, you can do it even for what, 1 hour, maybe for 2 hours, one up to 120 minutes, 2 hours. You know, 30 to 45 is the basic recommendation for acids, but it's fairly good in case of alkalis also. But yes, if you come to know that it was an alkali burn, you can go for a longer duration also, maybe 1 hour, maybe 2 hours. Yes, let us move forward. But say heat will be released in the environment. Heat will destroy the protein and it will cause what? Coagulation. Did you understand? Palak, try to understand. The heat will cause that coagulation. When we do surgery, we use that electrosurgical what, pencil. When we touch it, there is a sound. Do you know what happened? I'm imparting the heat, and heat is causing that coagulation. Now the coagulation will cause the proteins to get what you can say, sorry, energy is causing what, proteins to get coagulated first, and still I burn, it will be a charred charcoal, and then charcoal will not allow the heat to pass further. So try to understand, this has to be a self-limiting affair. The coagulum or the scar which forms will not allow the acid, or you can say the things, to go inside. So you wash it for 30 to 45 minutes, and then what happens? Yes, you check skin pH. Check skin pH after, or you can say, check the skin pH. After 30-35 minutes, you check the skin pH. Now, do you know what is the target skin pH? What is the target skin pH? The target skin pH is 7 to maybe 7.4 or maybe 7.5. So you have all those pH papers, no? pH sensitive paper, you'll touch it to the screen and the skin, and there will be change in the color, and then you can match that color with that what respective pH. So check the skin pH. Yes, if achieved, yes, if it is achieved, then conservative now. Conservative management. Continue the conservative management. If not achieved, yeah, if this pH is not achieved, then what to do? Yes, if it is not achieved, then you will have to debride that wound. And you'll have to debride that wound. Yes, debridement, 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 debridement. Do you know, it really feels good. I really adore Iron Man. Iron Man is really Iron Man. क्या बोले? Yes, you took my heart away. So strong, boss, so strong. You are really something, really something. I would like to meet you in person. Not like this. I'll not do any slogging. You should have respect for this person. He's so good. Look, despite so much of what you can say, he's boss Iron Man. I have to. Robert Downey will feel proud that there are people who follow him so strongly. So we have to go for debridement plus minus what, grafting, plus minus grafting. Grafting. Let us move forward. Now, let us talk about Oh yeah, yesterday I saw someone COVID also. I'll talk to COVID also now. Today I'll talk to COVID. Iron Man is my favorite character, but COVID is also. Let us move forward now. Okay, so we have debridement plus minus grafting. I hope management of this is clear. Now, someone was asking to me about the management of frostnip. But management of frostnip, frostbite, any freezing injury, same. You will do rapid rewarming. Generally non-freezing injuries don't require active management, but yes, all the other management, or if whenever you have a patient of cold burn, you have to do with that concept of rapid rewarming for 15 to 20 minutes. If you see that this is not working, you will counsel the patient that yes, this is not going to make, this limb might need amputation. You give time for the body to show you that zone of demarcation between the, you must have read in you can say pathology, dry gangrene and wet gangrene. In dry gangrene you have a line of demarcation below which it's black and above which it's healthy. So we'll wait for that time. Now let us move forward and let us talk about some special chemical burn. Special chemical burn. Special chemical burn. Special chemical burn. But you could have chosen another name. Now, COVID is not, मतलब you are, मतलब everyone is not, मतलब you have taken a name which is actually derogatory. COVID नहीं होना चाहिए था बच्चे. COVID ये जो COVID वाला नेम है ना, ये नहीं होना चाहिए. You मतलब word is fighting, everyone is मतलब scared and you have just taken a name. You cannot be monster, huh? You cannot be monster. You should actually, you should not use COVID. I'll give you one more. You should use this COVID-19. Yeah, this is good. This is good. Actually, this is good and this is acceptable also. Covered. COVID-19, no. COVID-19 is not good. Let us move forward. Let us move forward. Special chemical burns, we have HF. HF burn. Now, when we talk about HF, that is hydrofluoric acid. Hydrofluoric acid burn. Hydrofluoric acid burn. Hydrofluoric acid burn. What is the main essence of this? Now, try to understand. Bache, whenever there is a patient, now where do you get to see this hydrofluoric burn? Where do you get to see this hydrofluoric acid burn? Actually, you must have seen on glass panels, we make beautiful designs. Yeah, we make beautiful designs. You must have gone to barber shop, and when you go to saloon, they have made a beautiful design that haircut available here. Haircut, gents, right? Gents and ladies, gents haircut salon. So they make good what designs. Actually, for etching on that glass, you require a chemical which is known as what? Hydrofluoric acid. So accidentally, if it spills on your skin or your body comes in contact, it will be very dangerous. Now try to understand. All pens down. Try to understand this thing. All pens down. Try to understand. But just suppose the patient, I'll give you time to understand, try to understand this thing. I'm not teaching this thing from last maybe a couple of years. I just don't teach this in routine classroom, but this is lockdown and lockdown means something special. So this is lockdown special. Do you know this site is having H plus and F minus, H plus and F minus, and F minus. Now what is the problem? This F minus present in the wound, this F minus present in the wound combines with the what? Body's calcium. Because fluoride has a very high affinity for calcium. It combines with the body's calcium, and do you know what happens? When it combines with the body's calcium, there is formation of calcium fluoride. Do you know this calcium fluoride is exothermic reaction? This is exothermic, and since it is exothermic, there will be lot of heat and therefore pain. But pain is not the main thing. Do you know what is happening? Due to combination or complexing of calcium with the fluoride, the body's calcium level goes down. Calcium level goes down, and when there is decrease in calcium level, what will happen? This is what? This is heart. So let me show you. Yes, what happens? Hypocalcemia acts on heart, tararara and tararam pum pum. Gone. But this is the cause of death in what? Hydrofluoric acid burns. This is very, 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 very important. Very important. Okay. Amio jete pachina giant saloon. So try to understand that arrhythmia is the basic concept, and why it happens because body's calcium stores are consumed. So do you know, I'm giving you option. What should be the management? You will tell me and then I'll give you time to write. What is the management? I'm giving you option. First option is 3% or 2%. 3% topical calcium gluconate. Topical calcium gluconate. This is one. And the second option is 10% IV calcium gluconate. IV calcium gluconate. Tell me what will be the answer. Yeah. Tell me what will be the answer. I'll tell you. But say the treatment of choice is topical 10%. Topical 10% calcium gluconate. Topical 10%. Do you know what will happen? I'll give you time to draw. Just see. Suppose this is the wound. This is having fluoride. This is having fluoride. And what you will do? You will apply topical calcium gluconate. This is cream. What you have applied? Cream. Calcium gluconate. Do you know what happens? Calcium from the cream will combine with the fluoride. And do you know the moment it combines with the fluoride, there will be excruciating pain. The moment you apply the calcium gluconate cream, it will be extremely painful. Patient will shout in pain. After 5 minutes, he'll come to you and say, doctor, thank you for all whatever you have done for me. Earlier this was paining, this was very painful, but now I am comfortable. You'll ask, are you comfortable? He'll say yes. Are you comfortable? He'll say yes. The moment he says that yes, he's comfortable, apply the cream again, and again he will shout. Again, let him be comfortable. You keep on doing this procedure until unless you apply the cream, and that application is painless. Do you know what is the logic of this? Do you know the calcium in the cream is scavenging all the fluoride from the wound, and that is the motto. Because otherwise your body calcium will be what? Depleted. Do you know? Then why I have written IV calcium gluconate? Suppose injury happens, and then the patient is creating what? There is a lot of chaos, there's a lot of panic going on, and then someone advise apply cow dung, someone drink 2 liters of cow's urine and blah, someone says this, that. And by the time 1 hour, 2 hour passes, and then they take you to original doctor. When actually you reach to doctor, then the management starts. But tell me, for these 2 hours, 3 hours, 4 hours, who was giving the calcium to fluoride? It was your own body. So your own body's calcium stores will be depleted. So how will you check this? You will check this by measuring the serum calcium. If you see they are less, you will give a slow infusion of IV calcium gluconate. But say if you give IV calcium gluconate only, what will happen? You are sending your soldiers on the front, or you can say on the borders, to fight with the fluoride, and every time your fluoride is getting what? Consumed and killed. And there can be a lot of what? Disastrous effects of this. So the enemy is at the level of skin, so you have to go to the level of skin. Yes, this is given, IV is given to replete calcium stores. Please write whatever you have understood. Do you know? Don't copy like this. Surgery is an attitude, and every surgeon has a different attitude. Some people make port, you can say laparoscopic port with a Vere's needle. Some they prefer open technique, some blindly insert. So everyone is a different. So you should also create your customized surgery notes. So replete body's calcium stores. Below 7.5 mg per dl, you will have to replete it. Urshi, try to understand. But say if you keep on giving the IV calcium gluconate, what will happen? First of all, IV calcium gluconate needs to be given as a slow infusion. It's a lot diluted. By the time it will elevate calcium levels, there will be huge loss to the body, which has already occurred because of this calcium and fluoride action. Secondly, since the concentration of fluoride is at the skin level. So if you apply a cream directly at a skin level, it will directly consume majority of the fluoride at a one strike. So it's a time taking affair if you go for IV, and that too with a lot of problem. Yeah, 3%, 3%. Generally it's 2%, 3% also. Cost of cream is, cost of cream is, I think 30, I think it's 36 rupees. I think 36, yeah, 36 rupees. Cost of cream. But I'll answer all your queries, all your queries. Otherwise, you will post on club, sir. Don't answer my queries. But this is 10% IV, but topical we give 3%. Are we apply cream first, bacha? I'm saying we apply cream first. Treatment of choices, topical, not. But it's 3%, not 10%. Or you can search. You can search on net. Yes, you can search it. So let us move forward. Let us move forward. Uh today's business advice. I'll definitely advise. I'll definitely advise. I'll definitely give you advice. Next is others. Other burns. Other burns. So you have. Has everyone written this? Has every, but say CP IV is not given in all cases, only if the patient is having the blood calcium levels less than 7.5 mg per dl or ionized level somewhere around less than 4.5 mg per dl, then only we start with IV calcium. Otherwise, there is no need. Hey, what are you thinking? In chemical burn, what do you think? Huh? I'll ask the patient to go to wash. What do you think? I'll ask the patient to go to washroom and then just wait. You are thinking. You're thinking I'll ask the patient to go to washroom and start the tap, and then the patient is yes having the shower and washing the wound under running tap water. No, bache, sepsis will happen. So there are customized beds. There are customized beds, yes, which have the water flowing facility, which have a water flowing facility, yes. And then this is how you target. You'll not throw the what patient in the running stream so that all his body is smeared with acid. You will specifically target that area where you actually need the what. Yes, you can say you want to wash that part. Okay, let us move forward. But say chemical business. Okay, I'll tell later on. I'll tell. Okay, let us move forward. Acha, please. Okay, no, I'll talk to about that thing on the last day. Electric burn. Electric burn. Electric burn. Electric burn. So, बच्चे patient, we don't send the patient to washroom, huh? Acha, electric burn is always full thickness burn. Electric burn is always a full thickness burn. Full thickness burn. Next is, let me tell you. But say electric burn, why it is a full thickness burn? Until and unless current has a point of exit in the body, the burn will never happen. So already it has crossed the dermis, so it has to be a full thickness burn. Yes. Saran is asking what is 36.7. Someone was asking me what is the cost of tube. There are some students who also want to know the cost of tube. So I've said 37 rupees is the cost of tube. Please don't ask me what companies are available. Huh? Yes. So try to understand. Electric burn is always a full thickness burn. Yeah. Next is, let us talk about this. This is associated with, this is associated with cataract. This is the most common sequel. Cataract is the most common long-term sequel you should know. Cataract is the most common. Oh, what is happening? I think it's hanging. Cataract is the most common long-term sequel. Next is, second is, I'll discuss why cataract happen. Don't worry. Second is gas gangrene. Gas gangrene can happen. Gas gangrene. Third is pathological fractures. Pathological fractures. Pathological fractures. So cataract can happen. Cataract. अरे बच्चे green tea. I am drinking green tea. Queries solved. Please let me continue. Cataract, green tea. Saying green tea. Cataract, gas gangrene, and pathological fractures. I'll come back to them, why they happen. Let us see. Now, when we talk about electric burn, the next and the very important question is about damage. Damage. There are two important things. Maximum damage and minimum. That means most resistant structure and damage, maximum damage. So, maximum damage and least damage. Maximum damage, least damage. Maximum damage if you talk about, let's say it's the RBCs, you can say muscles or soft tissue. So RBC, muscle and soft tissue have maximum damage, Least. If you talk about least damage, you know, skin. The most resistant structure of, or you can say structure to the current is skin. What is happening? There's some problem. Skin greater than bones. So most resistant is skin, the least resistant is RBC. Now try to understand, since there is damage to RBC, there is hypoxic environment, and that is why you have clostridial infections are on the rise, because they will survive in what? Anaerobic environment only. So you have gas gangrene. Since there is damage to soft tissues, collagen of the lens is destroyed, and do you know 30 to 40% of the patients will have cataract in couple of years? And this is a very famous question. That yes, cataract is considered as the most common long-term sequel. Next is, let us move forward. Pathological fractures. Now someone is thinking, sir, you said that bones are very strong. Now you are saying pathological fractures. Bones are resistant using, now pathological fractures are common effect. But say bone without the soft tissue, that is a bone marrow, it becomes what? A brittle bone. And that is why pathological fractures are, yes, or on the rise. Now let us go to the concept of electric burn. Do you know one very interesting thing? In this is, first of all, electric burn will cause breakdown. So breakdown of two things. What are the things which will have a breakdown? So breakdown of muscles and RBCs. So breakdown of RBC and breakdown of muscle. But say breakdown of RBC means breakdown. I told you, white cataract happens because of the damage to soft tissue like collagen. Okay. Collagen damages, that is why there is opacification of the lens. So whenever there is breakdown of RBC, there is excess K plus release. So the breakdown of RBC will cause excess K plus release. When there is excess K plus release, do you know what will happen? This increased K plus release will go to the heart, and then ultimately you will have what? Yes, you know that? What? Tararam pum, tararara, tararam pum pum. Yes, this is very important. So what is the most common cause? What is the most common cause of this star phenomena? Of death? Ventricular fibrillation. Ventricular fibrillation is the most common cause of mortality. Okay, I just want you people to understand this chart rather than drawing a scenery in your notes. But see, whenever there is muscle breakdown, there is myoglobin release. There is myoglobin release. And do you know myoglobin release has two effects? What are they? Let us see. Myoglobin release will go to kidney and will be out of the urine, and this is what is known as myoglobinuria. This is what is known as myoglobinuria. Myoglobinuria. This is myoglobinuria. And myoglobin release or muscle breakdown or myoglobin muscle breakdown will cause metabolic acidosis. Metabolic acidosis, excess of. So try to understand, this was a question which was asked by AIIMS. They have not asked the what specifically mentioning about the electric burn, but they asked what kind of metabolic profile is seen in burns: hypokalemic acidosis, hyperkalemic acidosis, hypochloremic acidosis, hyperchloremic alkalosis. Answer is in front of you. What we get? Try to understand. Hyperkalemic acidosis. Hyperkalemic acidosis. Now all pens down from this point for maybe couple of minutes. All pens down. I'll give you time to write, students. I'll try to give you time to write. Now, do you know whenever we have a state of acidosis in the body, now who gets a command? Kidneys get a command. And what is that command? The command is, please correct this state of acidosis. Now how will kidneys correct this state of acidosis? By losing extra acid from the kidneys. That is why the acid will be excreted out of the kidney, and via urine this will be lost. And that is how the kidneys will what? Buffer. Now try to understand, majority of the damages occur in acidic environment. You know, Virat Kohli drinks water for the cost of that bottle is somewhere around 500. Yeah, 500 rupees. So why? What is so important? That is purely alkaline water. Today we have all those RO machines which are coming now in the market. We have alkalinizers attached to that machine. Do you know why? Alkaline water is safer than acidic water. So this is what is important, that majority of the injuries which happen, they happen at what? Alkaline, acidic pH. Now try to understand one very simple thing. Muscle breakdown, what is going inside the kidneys? Myoglobin. So that is why that is coming out and you have myoglobinuria. So renal tubules are already loaded with what? Myoglobin. And on background of acidic environment, the clogging of renal tubules with myoglobin precipitates down acute tubular necrosis, AKI, and then tararara, star phenomena. Now try to understand one very important thing. Very important thing. What is that? Bache, myoglobinuria, you cannot stop. Why you cannot stop? Because muscle breakdown is a catabolic process which has already started. It will take days, maybe months to get back to that original anabolism. So do you know, if you break one pillar, either you have to change the myoglobin texture or you have to break the pH. So if you change the pH of the urine, myoglobinuria in presence of alkaline pH of the urine will not precipitate acute tubular necrosis, and that is why the treatment of this myoglobinuria is what? Alkalinization of urine. So try to understand, myoglobinuria will precipitate ATN and ATN will cause AKI, and do you know that is why management for myoglobinuria, especially myoglobinuria only I am talking about, this chart has at least 6-7 MCQs. So treatment of myoglobinuria is alkalinization of urine. Alkalinization of urine. This is one thing. And now you will start correcting the what? Acidosis. And because of the heart, there has to be intensive what monitoring? Cardiac monitoring. Intensive cardiac monitoring. So this is what is completing. So intensive cardiac monitoring. Okay. So with this, we finish today's class. We finish today's class. This is and tomorrow we will start with what uh, the we are left with one burn, that is inhalational burn, and we'll discuss the management, and then we'll try to go to the plastic surgery unit. Okay. So this was a really very interesting and nice session with you. Yeah. This is my wood house. This is my wood house, and I have just customized it. I use it for study. I use it for all board meetings. This is my place of solace in my house. This is no one can disturb. No one can disturb. I just lock it and just enjoy this place. Enjoy this place. I hope you enjoyed. Yeah. So we use sodium bicarbonate. We start with sodium. Let them draw. Let them draw. Let them draw. Don't cut the session. Let them complete it. It's always a pleasure. Do you know, I always crack jokes with you people, and I just make fun of you, some of you, to make all the other students laugh. You know, the reality is that you people are the only friend of mine. I don't have many friends. The reason is, when I go to hospital, the patient is already intubated, and when I move out of OT, the patient is still what, in anesthesia. So most of the time I don't get that time to interact with anyone. Even my family is always, is not, they're not happy because most of the time I'm working round the clock. So you are the only one who just listen to me. Otherwise, no one wants to listen to me. That's why it's always a healthy conversation. And I that uh, pleasure of teaching young medicos, it's always giving me a kick to perform better. I think, I always think that I should give whatever I have, whatever I know, I should tell them. Because knowledge also follows the energy law of energy. 10%, you can constrain it. You have to let it flow. That is why whatever I know, I always tell everyone. Chalo, bye bye, everyone, bye.